with our schedule. This is the mask update or COVID-19 update for January 5th, 2021. Next slide, please. So since our last update 2 weeks ago, we've actually seen, even though there continues to be more cases and more deaths, it seems to be a little bit lower trend in that total number. Last time we were reporting over 3 million cases in a 2-week period. This year it's just, or this time period is a little under 3 million new cases. Next slide, please. For the state of Kansas, again, kind of seeing that same trend over the last couple weeks. 26,000 plus new cases, an additional 449 deaths across the state, and then of course an additional 51,000 negative tests through a lot of the testing that went on across the state in the last month. Next slide. In Saline County, we are up to 4,480 cases as of yesterday total. 2,600 plus have recovered. We still have a lot that we are following. And 12 additional deaths in the 2-week period, which brings our total as of, that should be as of 1/4/2021. I'm sorry, not 12/21. I'll correct that before we post this. But that brings us up to 69 COVID deaths for the year. Hospitalizations are still holding in between 30s and 40s in their COVID patients. Next slide. All right. We're getting kind of to the point, so I started adding in the numbers so it's a little bit easier to be able to compare month to month. Of course, still seeing a significant increase in cases in the month of December from November. I don't have a percentage breakdown yet of all of the free testing and how many tests were conducted and how many were positive. Hopefully we'll be able to compile that data here pretty soon. But the spread is still happening. I think the free testing probably helped identify quite a few asymptomatic positives who didn't know that they were carrying it and maybe potentially kept them from transmitting it to others over the holidays. But we still won't know the full extent of any type of holiday exposure from that time period, right before Christmas till after New Year's, here for at least another week to 10 days. Next slide. And you can see December has been our worst so far in the pandemic when it comes to deaths in the county. And those are all Saline County residents, not just deaths that occurred in the county of somebody that lives somewhere else. These are all residents in our county here. A lot of them are from nursing homes, but still, that's somebody's family member that has been dealing with that. And that's a lot for not only healthcare, hospital personnel and ICUs, but nursing home personnel who, having to deal with these events and having to deal with COVID in these facilities. And then also just kind of that next step of some strain that it has put on the mortuary services in the area trying to process all of those deaths. Next slide. So we still have a lot of clusters. We have a couple more long-term care, another private business. Again, just keep in mind that these will stay on there until 28 days have passed without a new case related to spread at that cluster. Next slide. Testing. Originally, the testing for the free testing sites across the state that were occurring in December was supposed to end at the end of December, but because of extensions of some of the CRF, KDHE has extended that until the end of January. Currently, right now, Well Health, who has been offering testing at the Church of the Cross, has some other dates available. For somebody who wants to get tested through that, if they go to that website, gogettested.com/Kansas, they'll be able to see where the site is, be able to book their time for the test, and see when those events are occurring. There may be other events. Dr. Kraft is on from Saline Family Healthcare as well. Dr. Kraft, did you want to mention anything about potential testing that you might have coming up, or is that still a little early?
We have a planning meeting this afternoon with a group that has interest in doing a similar mass testing event in the North Salina area. So initial discussions are underway for that.
And so once they have that finalized, we will help assist with pushing that information out to the public through our social media and our mass media, and help get that out there. Next slide, please. This is the one that you probably all want to hear about. And Dr. Kraft, I'm just going to kind of go over a few bullets and then we can both hop into this. Vaccines are being given across the county. We are well up over 1,000 that we have been given so far. Right now, the health department, Saline Family Healthcare, and Saline Regional are the vaccinating site, or not sites, but we are having to lead vaccination here in the county and working together to make that happen. Dr. Kraft has been kind enough to be on with us right now to help with either adding to or answering any questions right now about vaccines and vaccination. Dr. Freelove did have to leave, so he is not available right now. One feature that we started last week trying to get information out to the public is starting at Tuesday and Thursday vaccine updates on the off days from our press releases. And anybody that's interested in those, they can click on that link and sign up, as well as those updates are on our social media as well. Next slide, please. Also, KDHE right now is using a 5-phase approach to vaccinating the state. A lot of the questions that we get is, as different priority groups, when will we be able to get vaccinated? And right now, KDHE and all the counties are in phase 1, which is healthcare workers, nursing home residents, and staff, and EMS. And that is supposed to, or expected to, last through January. The who and when of those phases 2 through 5 have not yet been determined by the state. Dr. Kraft, Dr. Freelove, myself, and our staffs have been meeting now regularly here in the last couple weeks to try and compare the information that we have been getting from the state as far as vaccinations and the how-tos and the wheres and the responsibilities, as well as trying to fill in those blanks that are those gaps of information from the state. Dr. Kraft, what would you like to add at this point?
I guess I would add just a few little details to give you some sense of where we're at. Again, we've kind of been helping provide some logistical support to identify who the healthcare workers are in our area outside of the health department, our facility, and the hospital. A rough estimate of the medical providers that would have contact with COVID patients would be approximately 1,200 total people. And based on the supply that we have currently in the county, that would roughly hit about 1/3 of them. So we still have a significant way to go in getting all of the healthcare workers vaccinated. At Saline Family, we're getting rid of our supply today and tomorrow. So we're going out and vaccinating people off of the list, and we're marking them off as we go. And I think Jason would agree that one of the biggest questions is, when and how much extra supply are we going to get for the vaccine? we have no idea. So it just kind of shows up, and I think we currently have a good, solid plan to administer it when it shows up, but that's the big question, is how much and when.
Right. So it has been a challenge. We have both, I think, asked to the state, trying to get better clarification. And I'm not sure if it's an issue of they don't know right at this moment, which I think is probably part of it. And a lot of it, I think, too, is once they get it, and then we have some last minute reaction that we have to do to try and then make those arrangements. We also have staff working on vaccinating some of EMS. We'll be working on some other healthcare workers throughout the week for some of the other smaller agencies, just trying to get as many as we can with what we have, and then as we get more vaccine, continue to coordinate between our agencies to contact those agencies scheduled and get their healthcare providers, the healthcare workers, taken care of. Nursing home residents and staff, their vaccine is supposed to be coming through the National Pharmacy program through CVS and Walgreens. I haven't heard any significant issues yet, but I also haven't heard any significant achievements in that part yet either. So I think there's still challenges logistically that are being worked out there. While I still have Dr. Kraft on the line, are there any questions from commissioners? Oh, I guess probably one other thing I should add before I do that. One of the challenges that we have with the vaccines too, and is that the way that this comes packaged, it's not like flu shots that we got in the fall where they're individually packaged, they're refrigerated. You know, somebody can just basically come in at any time and, you know, we just pull one out and give it to them. These come in multi-dose vials that are frozen, that once they're thawed, a clock starts, and they're only good for a certain period of time after they are thawed. And then additionally, once you pierce the seal on that to draw out that first dose out of that 10-dose vial, that starts a second clock that's about 6 hours long when those 10 doses in that vial have to be used. So that creates an additional challenge of making sure that we have people lined up, or that we have, you know, readily, quickly be able to contact people when, say, we finish up a vial maybe that has 8 doses and we have 2 left, and we've got to find, you know, 2 additional healthcare workers or somebody to put that into so that we don't waste any doses. This vaccine also has a lot of stringent storage requirements and accountability requirements as well, that create additional challenges, you know, from normal vaccines we've had in the past. Chairman, it looked like you had a question.
Well, it's probably the cart before the horse, but, you know, again, not compare us to Sedgwick County, you know, where they're using Intrust Bank Arena to administer, you know, had people lined up for miles. If and when we get enough, do we have a plan? I mean, where we're going to administer this? Obviously, Saline County Health Department doesn't have the parking to take care of that type of a situation, nor does Dr. Kraft's facility. Are we going to use multiple places? Or I assume that you're talking about those types of things.
Yes, sir. So part of our weekly meetings now also includes how we are going to try and, especially now that some of the challenges that we know, which includes where you have to closely monitor them for 15 minutes after they get the vaccination. There's some additional documentation stuff with filling out the vaccine card so that they know when their second dose is. And I think those have added additional steps in that from our normal mass vaccination process. And then some of what we've discussed too is that in the past, I don't think it was, and this is, I think, you know, across all of our plans for several years, it really wasn't taken, I think, into consideration for mass vaccination, that most of the people that were going to have to do it originally were already going to be well inundated with dealing with patients and, you know, overflowing hospitals and case investigations. So we'll be looking at all of the others who can be able to help and be able to give all of, give this vaccination to the general public in a timely manner once as we get more. The hard part is trying to predict when that might be. So we're kind of planning in a vacuum without having any kind of time frame of when that's going to be.
My other is just a comment, and I think the last time that we met, I asked you if we'd had any documentation of people that are getting it multiple times. And I just want to say that I was in a professional office yesterday where the receptionist relayed to me that she had had it twice. And of course, I immediately questioned her, was she tested or whatever? And she says she was tested and did positively have COVID like 120 days apart. So I guess my message is to the public, because I've seen people doing this when they walk in somewhere. I don't have a mask on because I've already had it. I can't give it out. Well, this person was 120 days in between receiving, the first time they had the COVID and the second time. So people need to be cognizant of just because you've had it doesn't mean you can't get it again or convey it to someone else. So be vigilant.
Right.
So other comments from commissioners, questions for Jason or Dr. Kraft?
Commissioner Lees here. Jason, I have a question. The first phase, let me see if I have the numbers right. There's 1,200 people identified as eligible. And was I correct in hearing that we have 1,000 vaccines available in Saline County and that 300 have been administered? Is that correct?
No. Go ahead, Dr. Kraft.
Yeah, I'll clarify that. The 1,200 number does not include hospital, Saline County Health Department, or Salina family employees. So that, and I don't know what that number is. So the total number of healthcare workers is going to be greater than 1,200 by whatever that would add on. But out of that 1,200, we have supply to be able to do about a fourth to a third of that 1,200.
Mm-hmm.
Okay. How many vaccines have been administered so far in Saline County?
So I know the hospital received approximately 900 of the Pfizer vaccine. That was entirely used. We at Salina Family received 300. So far, at the end of today, we will have administered at least 200 of those with the plan of using the other 100 tomorrow. So, and I don't know at the health department how much you have received or.
We received 200 doses of the Moderna and started giving it out on Thursday with EMS, and we've done about 30, I think, at this point. But like I said, we have scheduled with some of these smaller providers this week so that supply that we have will be exhausted here in the next couple of days.
And it's my understanding that the hospital also received some of the Moderna vaccine, and they are going through some of their other employees as well. I think I remember the number 300, but don't hold me to that for their supply. So that would be approximately 1,500 total doses to the county if you add up everything.
And right now, I'm working on trying to have some sort of reporting that we can be able to show out there for, how many doses have been given, because it's going to be quite a while before we can expect, the state to have any kind of comprehensive information, I think, as far as doses given. And we want to be able to show how it's progressing here in the county.
Okay, and one other question that was asked to me, I'll pass it on, is how does the state decide how to allocate resources amongst the county?
That's a good question. They have a committee working at the state, and it has some kind of funky acronym as well that is meeting and trying to determine those phases. And exactly how they, like right now, how they are determining, say that Saline County gets, I don't know, 500 doses versus the next county gets 200. Their math or their formula, I'm not sure about that. That's not something that they've really shared on how they are allocating doses to counties.
All right, other questions from other commissioners or comments? If not, Dr. Kraft, thank you for coming on and helping Jason and helping the rest of us understand what's going on or not going on. So it falls back on the state, in my opinion. I mean, we're just not getting the information that we need to be able to communicate with our residents and the people in Saline County to give them accurate information. It just leaves everybody in the dark, so to speak. So, but thank you both for your efforts and your staffs. Thank you.
All right, there's a couple more things there.
Okay.
On the presentation. All right, Brad, if you can go to the next slide. One thing I just wanted to highlight real quick, is that our media relations person that we have contracted with has been doing a great job in trying to put things together to get out to the community. And this is one of the things that she has started doing the last couple of weeks is the hashtag Show Your Mask Monday. So if you go on Facebook and check it out, there's a lot of people getting involved. They're showing, pictures of themselves, selfies, wearing their mask, and we're trying to do a lot to bring the face to, COVID in the community and not just always talking about the numbers, but really trying to put a face to it. And then the last slide. So continuing the mask order, of course. The other thing I wanted to mention is that the current mass gathering health order is supposed to expire at the end of this week. And after consulting with the COVID planning partners from the hospital, Saline family, EMS, and the city, I plan to extend that current health order for 15 days, partially as we are still seeing the numbers not looking good, but also to take us through that post Christmas, New Year's holiday potential surge of cases there that is expected to happen. I'm hoping that people, here followed all the recommendations so we don't see that. But that will just be extended for 15 days and then we will reevaluate the situation.
Will that come before the commission, or is that something that just that happens through the health department totally?
So I can probably take that, Mr. Chair. So according to House Bill 2016, the county commission may review, amend, or revoke the order. So once Jason has an order for you to look at, we can discuss whether there's interest on the part of the commission to put that on for next Tuesday or schedule a special meeting. But you do not have to do that. I don't think Jason plans to make any substantive changes to what he's got out there right now.
Well, I, for one, would just as soon he handle it then, because there's certainly not going to be enough time there for me to say I want to do away with any part of that mass gathering. So unless some other commissioners object, we'll let the health department handle that.
I'm in agreement with you, Bob.
So proceed, Jason.
Thank you, sir. And that will conclude my presentation and my comments for this morning.
All right, thank you. I'm sorry to cut you off there a second ago, but thanks for getting everything done, and convey our thanks from the commission to your staff and all the hard work that they're going through too. So
Will do, sir. Thank you all.
thank you.